I think that, yeah, okay. Now we're good. So all participants will be in listen mode only until the end of the presentation. You can send in your questions via the chat box uh, down here, and then you can also message me privately. Those who are watching via YouTube, you can also type in your questions. Somebody will be monitoring that for us. The session will be recorded and we can provide you a copy should you wish for one. So yan po ang some reminders that we have. So let's now begin. Once again, good evening, ladies and gentlemen, fellow veterinarians and colleagues. First, I'm Lina Policarpio, currently the president of the UP Societas Mulierum Alumni Association, and welcome to the second episode of this webinar series labeled as COVID-19 Veterinarian's Perspective. Last week, Dr. Mondita Lim talked about the role of biodiversity and COVID-19, the interaction of these two elements, and she underscored the importance that we veterinarians play in protecting biodiversity and the critical role that we play in ensuring One Health is being practiced in disease control, more so during this pandemic. This webinar series was actually conceptualized and powered by the UP Society of Men and the UP Societas Mulierum with the main objective of providing fellow veterinarians as well as allied professionals and the industries we touch relevant information about COVID-19, how it impacts the profession, and how we can effectively adapt to the new normal. So again, we have lined up several topics for this series, and at the end of this episode, we will be sharing with you the list of topics for the next 2 weeks, and hopefully you can still join us then. So for our second episode, we have with us tonight, and for him, his very early morning, the former president of the Southern California Filipino Veterinary Medical Association and currently the vice president of the Southern California Veterinary Medical Association. Our speaker is part of the first batch of graduates of the UPCVM in Los Baños and graduated top of his class with the distinction of cum laude, o diba? He was also a finalist in the top 10 outstanding students of the Philippines. Being a well-rounded individual that he is, he was proclaimed Lakambini ng VetMed in 1988. For those who are graduated from UPLB, you know what I mean. You know what I'm talking about. So that's how well-rounded our speaker is. So without much ado, let's all welcome Dr. Raymond with the topic Pets, Vets, and COVID-19, how the virus changed the way I practice. Dr. De Villa, the stage is yours.
Thank you very much, Dr. Policarpio. So again, I guess good evening to everyone, and well, good morning to me. So let me see if I still know how to do this. Share screen. Go here. Okay, can everybody see that? Okay, so good morning. Well, again, good evening, everyone. When I was approached for this, I said, why me? But apparently, you'll know the reason why, a little while, okay? So the title will be Pets, Vets, and COVID-19, how it changed the practice, because it did have a very large impact on, I guess, not just us, but everybody, okay? Just like most speakers, a disclaimer first. I'm just a regular practitioner. I have no advanced degrees. I have no PhD. I have no MS. I'm just your regular dog and cat person. I have no financial relationships with any company. However, if anybody's willing to sponsor, then why not? And lastly, I may be the only one willing to wake up at 3 a.m. and it's now 4 o'clock just to give a Zoom presentation for Philippine veterinarians. So hopefully there are others out there. Okay, a small outline. We're going to review some of the coronavirus cases they've seen in animals. We'll find out what you can tell your clients with regard to the other coronaviruses that they may know of. We'll go to testing. What are the recommendations by certain groups, namely the WASABA and the AVMA? And how did we adapt these changes in the practice, and some thoughts on what we might see in the future. Okay. So before we start, well, not applicable anymore, but you used to have cell phones and pagers. You can switch them to silent. If we catch you with your cell phones beeping, they will be confiscated. And for those who can translate, they will be returned when the crows turn white and cattle egrets turn black. Okay. COVID-19 pets. The very first case was diagnosed in Hong Kong. I think by now everybody knows about this pretty old Pomeranian. They said was weak positive. Nobody really knows what weak positive says, but it eventually died at home. Non-known cause. The owner did not return the body back for an autopsy. There's another shepherd in Hong Kong that tested positive. However, the good thing is both pets did not show any symptoms attributable to corona. And the similarity is both pets came from households with confirmed COVID-19 patients. Then the next bit of news came from New York. And as we know, New York is the hotbed of coronavirus cases for people here in the US. It started with a tiger named Nadia, who tested positive. They anesthetized her and collected samples. After a while, they found some other big cats in their population showing some signs. And this time, without doing any anesthesia, for safety reasons, I guess, they tested them using fecal samples. I'm not sure if everybody knows, but yes, coronavirus can be isolated from your poop. There are actually some companies that are studying how it spreads or how prevalent it is in a community by testing sewage. Then the tiger that never developed a cough also tested positive. The other big cats did not show any signs, and they guess that the infection was from a staff person taking care of the tigers. All cats are doing well as of April 22nd. Then in Belgium, there's a cat that developed diarrhea and vomiting, other respiratory issues after the owner got sick. This time they tested the vomit. They showed high levels of virus. The cat is fine now. New York City again, the first case of COVID-19 in cats in the US. Well, and that is discounting the tigers. There was one cat that tested positive after showing mild symptoms. There were no humans in the cat's own household that were positive, so they think it came from somebody outside. Then there was a second cat also showing symptoms, but this time the owner was positive. And then the very first dog, he's famous for being this, Winston, okay? There were 3 family members already positive, and Winston turned positive. There were 2 other pets with him. The other one was called Otis, a 13-year-old pug, and nice name, Mr. Nibs, a 12-year-old tabby. Both of them turned negative. They think Winston was the one who got it because he was the closest one, probably snuggling, licking everybody. Okay, and Winston is now doing pretty well. In the Netherlands, there were mink farms that showed some minks with positive results. Okay, and the staff is quarantined. As of this morning, I was reviewing some articles, and we have this one. They think this might be the first case of mink to human transmission. They, looking into the article itself, they said that the DNA evidence of the human looks very similar to the one they got from the mink, and it is still under investigation. So that's another thing we may have to look out for. Other than that, despite the, at least in the US, 1.5 million, I think the whole world is like 3 million positive now. There are very, 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 very few cases of animals testing positive. Okay. So transmission in cats, it seems that majority of the well, you can call them victims, were cats. There were several studies. There was an article from the New England Journal of Medicine regarding these. They tested the transmissibility of the virus in cats. Essentially, the study says they started with 3 cats. They inoculated them and then it was detected by day 3 in all cats. Then they got 3 other cats with no previous infection. They put them together, and one of the other cats tested positive by day 2. Everyone was positive by day 5. What's a good thing about this? All cats did not show any severe symptoms of disease. So, conclusion, maybe of public health. It is a very small study. It's not very definitive, but it's still a possibility. So guidance provided by the CDC, there's a link here. You'll see a lot of links in some of the screenshots I took. So if you get a copy of this presentation, you can just take your time and view them from there. So that does not mean we should be doing this to our cats. I tried it and I do not think my own cat likes it. So avoid getting scratched, okay? So with this, what do you tell your clients, especially your cats, okay? So majority of you already know that there are 2 other main coronaviruses that we as vets deal with. The one for dogs, canine enteric coronavirus, and the one for cats, which is feline coronavirus. The enteric coronavirus can cause mild transient GI signs. It can also happen in cats. In dogs, it's a dead end. In cats, in some cases, if I recall, the ratio was like 1 in 10,000. It can mutate into a deadly form called FIP. They belong to the alpha coronavirus family, whereas in humans, the 3 main coronaviruses of concern was the SARS-CoV-2, which we have now, it's COVID-19. Previously, we had the SARS-CoV, and then the MERS or Middle East Respiratory Syndrome. There is still no evidence that animals can spread diseases to humans. We are with regards to the mink, that is still under investigation. This is just a side of that. We do know that there are vaccines that we use in the clinic, the canine coronavirus vaccine and the feline coronavirus vaccine. Both of these are non-core vaccines, so not everybody usually has them, and they're not really highly recommended for now. And actually, in the feline coronavirus vaccine, it is being discouraged because it doesn't really provide protection against feline coronavirus infections. And there is no evidence that it will cross-protect against COVID-19. So if you have clients asking if you can vaccinate them with canine corona and feline coronavirus vaccines, please say no. How do you test for them? IDEXX, everybody likely in the small animal world knows what IDEXX is. They made a test for COVID-19 just to help us veterinarians. And they've done testing. This data is as of 2 weeks ago. They've tested more than 5,000 dogs and cats from 17 countries and no positive results. Not everybody can get their pet tested. They have established some criteria. At least this is for the US. I'm not sure about other countries. You need to fit a couple of criteria. 1, pet is living in a house with a human who has COVID-19 or is tested positive. The pet has already tested for more common infections. This will include herpes virus, coronavirus for cats, upper respiratory tract infections for dogs. You want to take out as they say, when you hear hoofbeats, don't look for zebras. Take out or rule out the more common infections first. And if they're still not responding to medication or you have suspicions, then you can think about COVID-19. Pets, especially cats and ferrets, exhibiting signs consistent with COVID-19, more likely if they come from a household with a person who has COVID-19 also. Thousands of samples run. They use PCR. I guess everybody again knows PCR, polymerase chain reactions, which magnifies small bits of RNA. With regards to PCR testing, it does not necessarily, I believe it doesn't necessarily mean that there's an intact virus or an active virus. It just means that the virus was there. They may just be fragments, okay? And the WASAVA also conducted a serological survey this time, and especially with this, The main thought here is also that no SARS-CoV-2 specific antibodies were detected in around 1,900 samples, which excluded the possibility of 35 animal species. So the four most common species that can be positive would be cats. We've seen ferrets and minks, and I believe the golden Syrian hamster. So for those who deal with pocket pets, that's one thing for you to consider. So what do you do if your pet tests positive? Okay, just practice the normal safety precautions. Just like with people, there should be social distancing. You keep them away from the other pets, keep them away from other people. Try not to kiss them. Only few pets have been confirmed that caused COVID by pets do not show any signs of illness, but for those pets that did get sick, just have mild disease. And as a veterinarian, you're likely to be the first person they're going to call, so you should be able to discuss that. You can go to the website of the CDC itself. They have a special section there for COVID-19, okay? Pets with confirmed infections with the virus that cause COVID-19 should be restricted to also isolation in the home, meaning take precautions that you don't want to spread it inadvertently, because apparently they can also be asymptomatic spreaders if proven right. When possible, have another member of your household care for your animals while you are sick, okay? If you are sick, avoid contact with your pets. If you must care for your pets, again, wash your hands, wear a mask. Basic, simple, logical steps. After all, most people think their pets are children, so these are the same precautions you want to do for your children. You're not even allowed to hug them at this point. Sad thing, but that's how we are now. WASAPA guidelines, these are with regards to the vaccination, has given clear advice about the use of canine coronavirus vaccine. There is no scientific basis that this will provide cross protection. Must not be recommending or using vaccines in the belief they may protect even the dogs, okay? And the same for FIP. This is a bit of a long list. That's why hopefully you get a copy. Again, you can find it in the AVMA website. Basically, without symptoms, to practice good hygiene. Social distance your pets. Do not let them interact with strange pets. Since we know that cats are so far the #1 most susceptible in terms of pets, keep your cat indoors. And also for environmental reasons, it has been shown that cats are your #1 killers of basically life, insects, lizards, snakes, birds, and so on. They create the most impactful environmental damage, okay? Routine testing for SARS is not recommended, and right now it's still person-to-person transmission. So based on these, several organizations have already placed recommendations for what are the things you can do in your clinics to protect your staff, protect yourself, yet still provide veterinary services. Thankfully, just like other doctors, veterinarians have been classified as essential services, so we are allowed to remain open during the lockdown. So again, the CDC has provided guidelines. The latest revisions were on May 1st. This is the website that you can go through, but just go look for CDC and you'll find it there. Then obviously it's not just us who are in clinics. There are mobile house call veterinarians, there are farm veterinarians. The AVMA has guidelines for those too. Then this is a flowchart basically for vet practices. They, just like again with major hospitals, one of the first recommendations was to stop doing elective procedures and non-essential services. This was an effort to minimize exposure and to minimize the consumption of PPEs, because the sudden demand in PPEs created a big drop in supply, and they did not want people buying up PPEs, which would consume the supply needed by the first responders. So you just follow the flowchart. Is the case elective? Yes or no? You consider telemedicine or really bringing it in. And I think some of you may be subscribing to this website called TVP, Today's Veterinary Practice. It's free. I encourage you guys to subscribe to this. They're very good articles. And this one was around a month ago. Again, it discusses best practices for veterinary curbside control, which is what we're doing now. The OVMA, or the Ontario Veterinary Medical Association, somebody posted this a while ago. And again, this is the website for that one. They also have a step-by-step guidance on what to do and how to operate your practice. So, but the basic principles are education with regards to the staff and your clientele, physical distancing, PPE, cleaning, disinfection, and this is the big one, curbside service or alternative service delivery. And we'll go through some of the steps we have done in our practice with regards to these. Okay. So disinfection and cleaning. There are now quite a lot of disinfectants that may be used in the clinic. And some facts, so it has been known that smooth surfaces transmit viruses better than non-porous surfaces. Again, to emphasize the point, there's no evidence that pets become ill or spread it to other animals. I guess I'll have to include the disclaimer here, yet. So therefore, if you're not ill, you can interact with pets, but if you are ill, limit your contact with your pets. Stability in aerosol form, they say 3 hours. Copper is known to have antivirucidal effects along with, they belong to the same family in the periodic table. I think silver, that's why people like silver. 48 hours. Cardboard, 28 to 24 hours. Stainless steel, it's 72 hours, only less than 10% remaining. They don't know if the less than 10% is viable. And on plastic, less than 10%, 72 hours. So with these are your cages. And for plastic, maybe the cat carriers, okay? Especially if you are dealing with a lot of cats. So steps for disinfection, these are basic. These have been discussed during your time in school. You have to remove organic debris first. If there's a lot of poop, there's no point in spraying over the poop without taking it out, because then there are some disinfectants that can be, what's the term? Inactivated by that. Primary cleaning by scrubbing, degreaser, rinse, then you apply your disinfectant, okay? And the most important part there is letting it stand for an appropriate time. There is no magic disinfectant. You spray it, you count 1, 2, 3, then wipe it off. That works. It does not. There is the appropriate contact time for each type of disinfectant. Then you want to rinse and then dry. Okay. This, again, another good website for certain articles and plain veterinary education is Clinician's Brief. Once more, this is a free website. I encourage all practitioners to subscribe to this. It gives you nice articles that you can use daily. We all know detergent and soap. That's why you're hand washing. How does it work? It disrupts the envelope. Coronavirus is an RNA envelope virus, so it disrupts the envelope, in short, breaks it open and thus kills it. You wash for at least 20 seconds for your hands. Bleach or sodium hypochlorite, a 1:49 or 1:99 solution. It's not recommended for your hands, and it can damage some surfaces, especially those with color. Accelerated hydrogen peroxide, a 1:64 dilution. The brand name is called Rescue. It needs 5 minutes contact time. The nice thing about this particular product is it doesn't leave any smell and doesn't damage surfaces. Potassium peroxymonosulfate, I actually have never encountered this, but they say it can be used. 1:100 with 10 minutes contact time. Ethanol, we're already familiar with alcohol, 60% or greater. Therefore, the recommendations of using vodka or other alcoholic spirits, that does not hold any proof because they are less than 60%. Either way, you do not want to be spraying your hands with vodka because it's going to be a big waste. You'd rather maybe imbibe it and take some stress out. Chlorhexidine, everybody's familiar with chlorhexidine, a 0.05% with 5 minutes contact time. Chlorhexidine is available as a scrub or a solution, a 2% solution. You have to figure it out in your head how to make a 0.05%. Isopropyl alcohol, everybody knows Green Cross, rubbing alcohol, 1 to 3 minutes contact time. Hydrogen peroxide, 3%. I forget what it is in volumes. I think it's 10 volumes. Oh, kills sin. Well, apparently you can use it for confession. No, sorry, my typo. 6 to 8 minutes. Povidone iodine or betadine, 7.5%. Again, comes in scrub or solution. 5 minutes contact time. Problem with this, it will stain clothes. And quaternary ammonium compounds. These are mostly used, I would say, in larger facilities. I believe in the poultry and piggery industries. There are some clinics that do use this, but you have to rinse it out very well. So this is what we do. Every morning, mop the floors, clean up high contact surfaces. This includes your counters, tables, doorknobs, and phones. Clinic safety, it's always said, wash your hands, wash your hands, wash your hands. That can be emphasized more than that. Hand sanitizers, we already mentioned greater than 60% alcohol. Use of PPE, these are gowns and masks. Now, there's also a couple of articles on PPE. They found that, yes, in light of the lack of supply, you can, even during surgeries and so on, you can use cloth, both for your mask and your gowns, just re-sterilize them. After all, that's what we used to use before. One of the main things is avoid touching your face. That may be hard now. Not now, but a lot of people really touch their face. There have been some studies that your eyes are actually, even if you cover your face, your eyes can be an entry point for the virus, especially in the conjunctiva. There was a viral video of an experiment in Japan wherein they painted the hands of just one participant with, I would say it's an ultraviolet sensitive but invisible paint. Then they had a buffet type of party at the end of that time. They put on black light and everybody had it on them. So it shows you how easily it can spread. Maintaining social distance, this is the hardest thing to do when you're inside a small clinic and you really have to work close together. You try to do it as much as you can, but I have to say, in reality and practicality, it's almost impossible. So therefore, at least try to do the others and minimize the chances of contamination. So this is the rescue. This is the accelerated hydrogen peroxide. It comes both in spray and wipes. We put it beside the phone so you can wipe the phone in between uses. And on your sink, you have your soap, hand sanitizer, towels, and just everything ready to go. This is a nice quote from my friend. I think maybe a lot of you may also be experiencing this. I never thought that I would see the day when my hands would consume more alcohol than my mouth. This just goes back to the point that do not waste that vodka or rum. Ultraviolet light. So ultraviolet light, this comes from the National Academies of Sciences, Engineering, and Medicine. The main question is, can it destroy the coronavirus? The answer is probably. UV light has been shown to destroy other coronaviruses, so it will probably work on this virus. Main caveat, again, damages human skin, should only be used on objects or surfaces. There are certain airlines that are using robots to bathe the inside of the cabin with ultraviolet light. There are some surgical facilities or hospitals that also use UV light. I believe there's at least one clinic I know of in Cebu City that has been using it along with ozone. Just be reminded that it is also UV light that causes skin cancer. So do not expose yourselves unnecessarily. And despite what you've heard from some probably misinformed people, you are in all likelihood cannot insert a UV light into your body to destroy coronavirus. Nor can you drink bleach. Well, let's just say it will prevent you from getting an infection if you do not have yet an infection, because you will be dead. Staff safety, again, we already encountered some of that, but some of the things we have been doing. So now we're going to go to what we've been doing at the clinic. So staff members are encouraged to speak up when their family member is ill. Please tell your staff, do not be afraid to let me know if you're sick, because the Filipino mentality is work, work, work despite what you're feeling. But in times like these, it is important for them to let you know if they are possibly sick with coronavirus and you don't want to spread it unnecessarily. Give them the assurance that it is not going to be taken against them if they take a day off. No contact temperature readings are taken of all staff members in the morning. We first wanted to, it was very difficult initially to get the no contact thermometer because just like all PPEs, everybody wanted one, so it was out of stock. We polled the staff asking, do you want us to take your rectal temperatures in the morning? They said no, so we did our best to find a no contact thermometer. All staff members are required to wear their PPE. Currently, the temperatures have been rising, so the accommodation we made here was they can wear they are allowed to wear shirts and shorts underneath the PPE, especially when the weather's hot. Okay, that's at least a consideration that we made. You do not want your staff to faint because of the heat. And for myself too, in terms of changes I've made, I've taken to wearing, well, a shirt and shorts underneath my scrubs. So when I get home, I go to the garage, take off the scrubs, put them in a laundry basket, and before I enter the house, also change my shoes. There have been some studies that coronavirus may be transmitted through shoes, so that's just an extra precaution. You have different shoes for work and for slippers at home. And in terms of education, a short staff meeting is held at the start of each day to brief everyone on what changes, what new developments have been seen throughout the day, especially with regards to the virus, and what to expect in terms of appointment and workload, because you want them to know what they're facing. So this is the picture of our staff. I only have 4 staff members, and we have a daily briefing. And this is our thermometer. Obviously, no contact, then everybody, it gets logged in. If you have a fever, you're requested to take the day off. Now, other changes we've made. We used to be an appointment and walk-in. The old clinic I used to work at was walk-in only. The problem with walk-ins is that you do not know what to expect, nor do you do not know the workload. But because of the present situation, things have changed. No more walk-ins. Everything is by appointment. If it's an emergency or it says we need to be seen and we cannot take it, we either refer to an emergency hospital. Thankfully, there are at least 2 emergency hospitals near us. Disadvantage there, the price they pay will maybe double or triple. Or if it's not so bad, but we need to do the same thing, like a follow-up or of a previous case, but the appointment book is full, we do a same-day drop-off. They drop off in the morning. We fit it in between appointments, try to get it done, and they go home in the afternoon. Euthanasia used to be a very personal procedure. You want the clients in there. A lot of them want to be there with their pets during their final time, but it is not an option at this point. They are encouraged to say their goodbyes at home before bringing in the pet, especially if it's something that's also scheduled. So they just drop it off. It's very sad, but again, it's necessary. I do not know how there are some other home service vets that do euthanasia are doing it now, but I would suspect they have also made some changes to their protocol. As I mentioned, appointments are made either by phone, website, text, or via an app. We have an app for the clinic. In terms of files and folders, we're the only ones who touch it. The clients who don't get to it. We're still not 100% paperless. I really prefer writing things down. And they're pulled out the day before to facilitate checking in, review the history, and what needs to be done to the pet. For new clients, since they cannot come in, we have some information sheets for them outside the door. Then they knock on the door, they submit the sheet, then we go through it. So this is where I work. It's called Downey Veterinary Hospital. It's a very small hospital. It was established around 40, 50 years ago. The building is still there. And these are the signs people don't read. This is what greets them at the door. Despite all of these, they still knock and keep trying to enter. So we actually lock our doors so they really can't enter. This is what we have for the first timers. So once they fill this out, they can knock or text us or call us, and then we can process them. When the client arrives, like I mentioned, they call or text the clinic to let us know where they have parked. So you want to have numbered parking slots. You don't want them to say, I'm beside this big tree, beside this, or I'm parked beside this white car. Who knows where they are? So you put numbers on your parking slots, okay? The numbers should be seen by the client so they can tell you where they are. And this is an important skill. It's not just knowing your dog or cat breeds. You have to know now your vehicle breeds. If you don't know the difference between, let's say, I don't know, a Volkswagen and a Toyota, you may have a hard time. Hopefully you know the color. Then a staff member is designated to meet the owner at the parking spot, take a little bit of history, and bring them on. Another safety precaution, we use our own leashes. We have the thin, well, these are the giveaway leashes that used in some clinics. You have your name there, your phone numbers, but we reuse it. So we don't allow them to use their own leashes. We change it to our own. And then once we're done with the pet, we dump it into a bucket with disinfectant and reuse it after washing the next day. And truly, no owners are allowed inside, even to use the restroom. There is a store beside us that we just tell them go there because it's a grocery store. They can go in there and use the restrooms, but as much as possible, unless they're handicapped or really, really in dire need, no one gets in. So this is our appointment schedule. It's usually fully booked. At present, we're booked all the way to, I think, the middle of June. So that's why we have to take in some of the drop-offs. And this is the app. So you can request appointment or services here. You can call directly and so on. Client location, like I said, these are a few of our parking spots, and you can see the numbers there so they know where they are. And again, there are instructions. Parking, where are you? I'm in parking space 1. Are you checking or picking up? You can call or text. Wait in the car. By summer, this may be very uncomfortable for some of the owners, because unless they really have to leave the car running with the air conditioning on, because it will be very, very hot. We had to put this statement in because it takes a lot of time to call them. They don't answer, or they'll say, or they're not there to pick up. It, slows down the whole process. This is the skill. So you have to know what type, when the receptionist tells you it's in this slot, this type of car, you have to know what to look for. Your techs, yourself, or your assistants should be familiar with all the different breeds of cars by now. So these are our reusable leashes, and the bucket you dump them in once you're done. And we've so these are our folders, and we've made this particular small piece of paper which indicates the check-in time, the appointment time, so you know which one goes first. The last name of the owner, you want to confirm who they are, pet's name. their cell phone, and whether you need to talk to them in Spanish or English. In my area, there's quite a lot of Spanish speakers. A lot of you younger vets probably did not need to undergo 2 years of Spanish. For the older ones, I'm now thankful that yes, I finished 12 units of Spanish. It has helped a lot. And then you have the type of car and the parking slot. It makes things a lot easier. So you send out the staff to get the pets, rain or shine. Thankfully, it does not rain as much here in Southern California. It's mainly sunny, but in case it does rain, we still have to do our job. This is now what our new waiting room looks like. I call it the ghost town. All the seats are to the side. It's empty. Usually, you do not want to see a waiting room empty, but nowadays, that's probably going to be the norm. If ever we decide to open, we'll probably be spacing them out, maybe just 3 areas so you have enough distance between each one. And we'll see. So, history taking physical exam. What are the changes? Number 1, we've modified the forms a little bit to be more inclusive as much as possible. So those taking the history outside will be able to get as much information as we can. This is a modified form which I stole from somebody who also copied it from another clinic and modified it to fit our needs. The yellow one is for dogs, the green one is for cats. And so it includes the name and so on, the date, the appointment time, who looks at it. This area is for your S or your subjective, that's the history. Then the basic questions: appetites, vomiting, diarrhea, coughing, sneezing, PUPD, fecal score, itching score, vaccinations, medicines, illness. This is your examination area. This is where you put your objective data and what are your recommendations. On the back, the results of the testing, your tentative diagnosis, prognosis, other tests you want, medications to go home, rechecks, and so on. It tries to answer all the questions that you might need to know for each case, and also helps the next doctor to see what your thoughts are. An ideal medical record should allow your next doctor to look at it and understand what the case was, what you're doing, and what your attempt is, okay? Then, for each particular case, I made these sort of information sheets for the staff for them to go over. These are some of the pertinent questions. For example, in lameness, basically you want when did it start, or notice the problem, which is the leg, front, right, back, because most of them, they'll say check for lameness, and then that's it. Any activities, lameness getting worse or so on, any problems, and so on. Medications. For tumors or lumps, when did they first notice? How big is it? Is the pet bothered? Previous medications. This one is about skin rashes. This one is about eyes and ears. The one's about vomiting. One about diarrhea. One about coughing and sneezing. Then I think I just duplicated it. So they have this guide when taking history over the phone, when taking history in front of the client. So these are some of the basic questions I want to know with regards to a particular case. You may decide to make your own a little bit differently. That's fine. Then once the pet is brought in, you get your basic TPR, temp, pulse, respiratory rate, and weight. It's all logged in. The basic physical exam is usually done by the techs or the assistants. They do a look-see. They already know how to detect a murmur, check for lumps, and so on. They make particular notes. And then, as the veterinarian, then you come in to do your focused physical exam. If the complaint is the eyes, then you do a basic examination of the eyes, plus do additional testing and so on, or an ear in this case. And we all know that the price you pay for having a cute bulldog face are eye problems, ear infections, skin infections, respiratory infections. It does take a while before new bulldog owners regret the fact that they bought a bulldog, but it does happen. Options during the exam. Okay, you want to keep the owner engaged and involved. It is now impossible to do this with them outside. So things you can do. You can call over the phone and you can do your physical exam while narrating your findings. It's as if you're telling a story, which actually you should be doing when you're doing your physical exam with the owner in the room. You want them to know your thought process, what your findings are as you go through the pet. One, as you finish through the pet, it lets them know that you are actually examining. They already know what the findings are, and they will feel that the service is well paid for because you actually did an exam. There are some vets that go around the pet, just touch it once or twice, then say this is the problem. And you get a lot of comments that owners don't really like that because it's like you're going to the doctor will just tell you, stick out your tongue, and then makes you a prescription. You have no feeling of having, paid for what the service is. In the era of telemedicine, you can do a Zoom or video call. There's FaceTime if you have an iPhone. There's Zoom, there's Google Meet, Microsoft Teams, Viber, Facebook Messenger. All of these allow video. I would suggest if you're doing this, you use a dedicated unit that does not contain your personal information. You buy one for the clinic. You can mount it somewhere where everything can be seen, because we used to do it in the Philippines. I don't know if a lot of you practicing back there still do it, but you give out your personal number. Here it's discouraged, so I do not want them calling me at all times of the day. So you use one that you will make into a clinic account. Then you discuss the issues noted in the exam, and this is something that we now do. Before you leave the room, the owner takes care of the pet. Now, since there is no owner, you place the pet in your back cage and you do the next steps for estimate and approval. So this is now the new waiting room. Everybody gets to chill out a little bit while you are trying to get in touch with the owner, getting an estimate, getting an approval, having the payment, and so on and so forth. Just make sure that you put clear identifiers on each pet. You don't want to be doing a procedure on somebody else's pet, okay? Most especially, you don't want to do euthanasia on a pet that is not supposed to be euthanized. Then, like I said, you make the estimate based on what you saw and get approval over the phone. That is the hard part, because you'll see later on one of the recommendations to get a number of phone lines. We only have 3 lines, and more often than not, all these 3 lights are on. Sometimes you have to wait between 3 to 5 minutes just to get a line free. You have to act fast enough because, 1, it takes some time to bill out the person. 2, people keep calling in because they can't get inside. Okay. Then, once approved, you perform your treatment, testing, or medications. You have to be sure to advise the owner if they will wait for the pet or come back at a later time. If it's just vaccines, if it's just deworming, if it's just something that's simple, yes, they can wait. But if it's a longer procedure, before you can tell them, oh, I'll be with you in a while. But now you'd rather, because they're in the waiting room where they're a bit comfortable, they probably have a TV set, they probably have their own iPad or doing something else. But now sitting in the car for 2 to 3 hours is not fun. And you're also running your engine for the air conditioning, so it takes up gas. So you tell them, wait or come back. So you do what you said, x-rays, blood work, whatever it is, then you let them know. When they're done, you call them again. You bill out. So billing out is usually done by phone. I'm not sure how prevalent that is right now back home. But you get the credit card information and you run it through the phone, okay? And then you bill them out and pick up the pet. But this is what actually happens. So you wait, and you fall asleep because all the lines are busy, okay? Then, once you finally get in touch with them, you release the pet. You either you bring out your credit card slip for them to sign it, and you bring the medications outside. The techs and assistants know the additional instructions to give, but you should also have written instructions that are clear, because you do not want them calling again and tying up your phone lines. Done. This is the staff, okay? all wearing face masks. They don't have PPEs because these are our receptionists. And basically, this is the thing, you repeat multiple times a day with overlapping cases. That's the hard part. And where does the overlap come from? During the wait time. Obviously, you do not want to waste 10 or 15 minutes while trying to get in touch with an owner, making an estimate. So then you take another one, and then it piles up and piles up. So again, the sequence of events: signalment, chief complaint, history taking in for basic exam, focused exam, phone calls. If you need to clarify history, you make your differential diagnosis with recommendations, call the owner again to say what's there, get approval, disapproval for what you want to be doing, do the treatment, then call again to either to pick up or wait. And then once it's done, call again to build them out, and then they'll call again to come back. So the phone line is very, very important. How am I doing for time? Almost. Hope nobody's sleeping. Personal comments. I keep mentioning it's very, very time consuming and frustrating. It's very resource hungry in terms of manpower and materials. Manpower means the staff, because instead of the owner holding the pet, you still need to have one staff member to hold the pet, and you can't do anything else. Materials, these are your PPEs. I've already said multiple phone lines. You need consistent and reliable internet if you're using any video type of call. And I miss the face-to-face interaction because it feels for me, it is very personal. And you can pick up body clues on certain questions you want to asking. And I miss the fact that you can actually show them what you find that makes them appreciate you. And already mentioned, it can pile up very quickly. Sometimes you end up juggling 2, 3, even 5 cases all at the same time. And because of that, your lower caseload obviously translates to lower income. Thoughts on the future? These are just mine. Everybody says this will be around for a long time. So this may be the new normal, okay? You don't really expect everything to go back to the same normal as before. Curbside drop-offs, this may really be a thing now. And if you allow inside, already mentioned, a few clients at a time with social distancing. You cannot have them packed like sardines inside. Daily temperature checks, again, your choice, rectal, oral, or no contact. Then your clinic becomes like a bank. You have plexiglass barriers. If you're already going to let staff in, plexiglass barriers between clients, staff, and doctors. There are some who are saying they're going to put some like transparent shower curtains as dividers inside the exam room. So the owners will be outside they will be on one side of the curtain. The doctors and staff will be on the other side. That decreases the contact. Increasing telemedicine. I don't use telemedicine as much. I really prefer a hands-on approach, but this is something we'll have to figure out in the future. And obviously, because they can't get in, Dr. Google will be your enemy again. And you don't want them to come in just to get a refill. So if you have an online pharmacy like we do, you can do online orders and refills there. And cash has been shown, I think, to be a mode of transfer, or might be a mode of transfer for coronavirus. So no more cash transactions. They can just either slip the card so you don't touch it, or as we've been doing, over the phone billing out. Take-home message. Basically, there's aside from that mink, which we said earlier, there is no evidence of transmission from companion animals to people. So make that clear to your clients. And I would say, as a caveat, you can add a very silent yet. Okay, but still minimize contact with pets if they are infected. Final thoughts. This is from Richard Bach, who wrote Jonathan Livingston Seagull. Everything in this book or in this lecture may be wrong because things change. Well, that's it. Thank you to the UP Society of Men and UP Societas Mulierum for inviting me to speak and for your untiring efforts to uplift the Philippine veterinarian. Stay safe and sane, everyone. That's the end of my show. Let me see. Stop share. Any questions?
Yes, thank you, Dr. De Villa, for that very unselfish, I would say, unselfish sharing of experiences, and what you have done actually to to change the way you do things. Now, there are several questions. I was just cut off kanina, but I noticed there was one question on the feline, on the cat that was tested positive, the tested positive.
Which one? The
Was
New
it,
York or the?
uh, whose
Did it come
question was
early?
that? It was, I think that was Dr. Ordinario's question.
Uh-huh.
Was it tested for FCOV or feline coronavirus as well?
The article did not mention that, but I'm going to assume if they follow the guidelines for animal testing, they had to rule out all the other problems first before testing for feline coronavirus.
Okay, there's another question from Dr. Andaya. Hi, Doc Raymond. Not sure if you covered this earlier with the new normal. Would you see some wellness services being offered more as home service to lighten the foot traffic in pet hospitals?
I think that is going to be a good option. However, as mentioned, I did not go through the guidelines for mobile house call veterinarians because I don't do that. But you want to look at their recommendations to see how to protect yourself. You might need to wear PPE for each household that you go to.
Oh, yeah.
Because
Okay,
if
there are, sorry,
isolating
go
at
ahead.
home, one of the things you may, I didn't really go through it very well because it was in the guidelines and they want to reach it. But when you talk to the prospective client, you have to make sure you ask them, is anybody in your household sick or has been diagnosed with COVID? And that will tell you to take extra precautions. So we have been using cloth materials so we can sort of at least keep it on for the whole day, because I would say in general, most of our clients are negative or they don't have anybody sick. But if I recall, the recommendation there is if you are getting a pet from a household with somebody sick, number one is have somebody else bring the pet, not the sick person. And number two, dispose or change of your PPE after handling that pet. Did that answer the question? I hope.
So thank you for that answer. There's another question here. You had a long list of changes in the way you practice. Which one was the most difficult to implement?
Like I said, my frustration, not difficult to implement, but difficult to translate to personally would be the lack of face-to-face contact. Because like I said, I like to interact with the client. I make jokes. We talk about sometimes even their life, because I've said a lot of my other contemporaries have probably, or even the ones that went through a little bit of internship with me, will remember that I keep telling them, your success in practice does not necessarily depend on how well you treat the animal, but a lot of it is based on your relationship with the client. Even if their pet is dying, if you have a very good relationship and you're able to give them the news in a way that's not so hard, it's always a good thing. So I miss that interaction. The phone is very impersonal. You want to be able to, for me, I really want to interact with them. That is the most difficult thing in terms of the changes. The others are stepwise. And then I guess the other one would be the waiting time in between. The phone is really, really, really frustrating.
Okay, yeah, thank you. That's the sociable animal that you are. I'm sure it's
I'm a very private person. I'm shy, actually.
for you to do that. Okay. There's another question. How much additional investment did... Oh, okay, kaya lakambini, ano. Yeah, there's a question here, Dr. De Villa. How much additional investment did you infuse to apply all the changes that you did?
Okay, so not much, because number one, so the cloth PPEs that we were using, those were actually old supplies, because we have moved on to disposable gowns. So these are the old, I told you that the clinic has been there for quite a while. So these were the old gowns. We just took them out of storage and have been reusing them. The masks, we have cloth masks and the surgical masks. Personally, because I don't really interact with the client as much, for me, one mask lasts for one whole week. Okay. And then
Hola.
the disposable leashes, we have that because that was part of our marketing program. Sometimes you give them away. The plexiglass barriers, that's a very, very minimal cost. We already had a billing out through phone. So not much. The main change was really not taking them in. I would say that would be the number one change that we made.
Okay. There's another one here. What particular products or product lines do you think the companion animal market would need considering the impact of COVID-19?
Well, I would say just like with human medicine, I would say supplies in terms of PPEs and disinfectants and sanitizers. Everybody's going to be looking for that. Some of them, I don't know if you want to, if as a clinic, if you want to be selling some of that too as an additional resource. Medication-wise, so far, there has been no overlap, I guess, in what they use for treatment. There was an article before, during the early days, that they were thinking in some countries to recruit veterinarians to help with managing COVID cases. And because there was a scare on the scarcity of ventilators, there were some countries sort of considering that they might borrow the ventilators of veterinary clinics if necessary. Product-wise, other products, offhand, I really can't think of much. But
Okay.
PPE and it's never going to be out of style. The PPEs and your hand sanitizers and your disinfectants, because that's going to be not just for the clinics, but for everybody else.
Thank you. Any other questions from the floor? I see Ma'am Vera is here. Who else is here? You might have questions. Just type in here or unmute yourself. Any questions from your end?
Wala.
Okay. Meron isa pa. Meron pa dito isa pa. Where is that? I think you answered this in your presentation. Did COVID-19 affect the number of clients going to your clinic? And how do you encourage clients to still see us?
Okay, so actually,
I think you mentioned that earlier, right?
Yeah. No, it did not. So number one, because we're still an essential business, so we are open. The one that would prevent them from going out would be their own fear. But people here really treat their pets as children, so they will make all efforts to come. Number two, apparently the demand is more because I think it's for two reasons. One, because we're only appointments, so therefore the slots are limited. Before we would have also walk-ins, and the walk-ins can sometimes exceed the appointment. So now since everybody's an appointment, there seems to be a real need to please get me in. And then the second thing there, I think, would be because every clinic is likely doing the same thing. If they can't get into their previous clinic, they will try to get into another clinic. And actually, I've been seeing a lot of new clients, and I typically don't ask them why they chose us, but that's just my assumption. I do not see, so far, we have not seen any lack of demand. It's actually lack of time to be able to attend to them all.
Okay. All right. Thank you, Dr. De Villiers. 6 minutes over time, but thank you very much. Would you like to share your final thoughts on this webinar before we go?
Okay, so once again, thank you for giving me this opportunity to give our side here. I hope everybody back home is doing well. And some of these techniques that I've mentioned, I hope you can implement. If you do get a copy of the presentation, the websites for the different resources are there. Please feel free to look at it, but basically you can find it. Just go search CDC, AVMA, WASAVA, and so on. They will always have that there. And that's it. Hopefully everybody gets to sleep well. I will try to sleep again. And
Yeah.
stay safe, everyone.
Thank you very much, Dr. Devilla. By the way, it's what time is it now there? It's 5
5 in
a.m.
the morning.
5 in the morning in California. I woke up at 3 a.m. just to join us here in the Philippines. So we really appreciate your sacrifice and your service to the Filipino veterinarians, Dr. Devilla. And to all our participants, thank you very much for tuning in. We also have attendees via YouTube. If you want to have a copy of this webinar, we can send you a recording as well. So once again, thank you. We have 2 other webinars lined up for the next 2 weeks. Can you flash it here? And we do hope that you will still be able to attend these 2 webinars. The next one is Dr. Andaya, JM Andaya, tackling about the veterinary pharmaceutical distribution and how they coped with the coronavirus pandemic. And the next would be Dr. Pawi Kamayo, who's in South Korea right now. She will be talking about COVID-19 response of South Korea and the implication of SARS-CoV-2 on veterinary research. So those are 2 likewise interesting presentations. We do hope that you can also join us. So once again, everyone, thank you very much. It has been a pleasure having you tonight. And I think it's time for dinner. So Dr. Devilla, you can go back to sleep. Thank you again.
I actually go to sleep like this, so these are my.
Okay. Thank you, guys. Thank you very much. Bye.
Bye, everyone. Stay safe.
Yeah, stay safe.